Imagine you have a stomach ache that doesn't go away. You think it's just a minor issue, maybe something you ate or drank. But what if it's something more serious? What if it's a sign of gastric cancer, one of the deadliest cancers in the world? Welcome to today's video where we will talk about gastric cancer treatment options and all about what you need to know. Gastric cancer, also known as stomach cancer, is a type of cancer that starts in the lining of the stomach. It can grow and spread to other parts of the body such as the liver, lungs, bones, and lymph nodes. Gastric cancer is the fifth most common cancer and the third leading cause of cancer death worldwide, affecting more than 1 million people every year. Some of the main risk factors for gastric cancer are having a family history of the disease, having an infection with a bacteria called Helicobacter pylori, eating a diet high in salted, smoked, or pickled foods, smoking, drinking alcohol, being overweight or obese, and having certain medical conditions such as chronic gastritis, stomach ulcers, or pernicious anemia. Some of the common symptoms of gastric cancer are indigestion, heartburn, nausea, vomiting, loss of appetite, weight loss, abdominal pain or discomfort, bloating, difficulty swallowing, and blood in the stool or vomit. However, these symptoms can also be caused by other conditions, so it is important to see a doctor if you have any of them for a long time. In this video, we will explain how gastric cancer is diagnosed, what are the different stages of the disease, and what are the main treatments available. We will also provide you with some tips and resources for coping with gastric cancer and living a healthy lifestyle. By the end of this video, you will have a better understanding of this serious condition and how to deal with it. Gastric cancer is a life-threatening disease that can affect anyone, regardless of age, gender, or ethnicity. It is often diagnosed at a late stage, when the chances of survival are low. However, if detected early and treated properly, gastric cancer can be cured or controlled. That is why it is crucial to be aware of the signs and symptoms and to seek medical help as soon as possible. This video will help you learn more about gastric cancer and how to fight it. So, are you ready to find out more about gastric cancer treatment options? If yes, then stay tuned and watch this video till the end. You might be surprised by some of the facts and events we will reveal. Let's get started. Before we talk about the treatment options for gastric cancer, we need to understand how this disease is diagnosed and staged. How do doctors find out if someone has gastric cancer and how advanced it is? What are the tests and procedures involved, and what do they reveal? In this section, we will answer these questions and more. The diagnosis of gastric cancer usually involves several steps. The first step is to perform a physical exam and ask about the patient's medical history, symptoms, and risk factors. The doctor may also order some blood tests to check for signs of infection, inflammation, anemia, or other conditions that may be related to gastric cancer. The second step is to perform an endoscopy, which is a procedure that uses a thin, flexible tube with a light and a camera at the end, called an endoscope, to examine the inside of the stomach and the esophagus. The endoscope is inserted through the mouth and down the throat and allows the doctor to see any abnormal areas or growths in the stomach lining. The doctor may also take a small sample of tissue, called a biopsy, from the suspicious area and send it to a lab for further analysis. The third step is to perform some imaging tests, such as ultrasound, computed tomography CT scan, magnetic resonance imaging MRI scan, positron emission tomography PET scan, or X-ray, to see if the cancer has spread to other organs or tissues. These tests use sound waves, radio waves, or X-rays to create detailed pictures of the inside of the body. They can help the doctor determine the size, location, and extent of the tumor and plan the best treatment option. The fourth step is to perform a surgery, which is sometimes done to confirm the diagnosis, remove the tumor, or relieve some symptoms. Surgery may involve removing part or all of the stomach, along with some surrounding tissues such as the spleen, pancreas, or lymph nodes. Surgery may also be used to create a new connection between the stomach and the intestine, or to place a stent, which is a metal or plastic tube, to keep the stomach or the esophagus open. The staging of gastric cancer is a process that describes how far the cancer has spread from its original site. The staging is based on 4 factors: the size and depth of the tumor, the involvement of the nearby lymph nodes, the spread to distant organs or tissues, and the grade of the cancer cells. The grade indicates how abnormal the cancer cells look under a microscope and how likely they are to grow and spread. The staging system for gastric cancer uses a combination of numbers and letters to describe the stage of the disease. The stages range from 0 to IV, with higher numbers indicating more advanced cancer. For example, stage 0 means that the cancer is only in the inner layer of the stomach. Stage I means that the cancer has grown into deeper layers of the stomach or nearby lymph nodes. Stage I means that the cancer has grown further into the stomach wall or more lymph nodes. Stage I means that the cancer has grown through the stomach wall or into nearby organs or tissues, and stage IV means that the cancer has spread to distant organs or tissues such as the liver, lungs, bones, or brain. The stage of the gastric cancer is very important for the prognosis and treatment options. The prognosis is the outlook or chance of recovery for the patient. The treatment options are the methods or strategies used to fight the cancer. Generally, the earlier the stage, the better the prognosis and the more treatment options available. However, other factors, such as the patient's age, health, and preferences, may also affect the prognosis and treatment options. So now you know how gastric cancer is diagnosed and staged. But what are the main treatments for this disease? How effective are they, and what are the possible side effects? In the next section, we will discuss the treatment options for gastric cancer and what you need to know before choosing one. Stay tuned and don't miss it. In the previous section, we learned how gastric cancer is diagnosed and staged. Now, we will talk about the main treatments for this disease and how they can help the patients fight the cancer and improve their quality of life. There are many different treatments for gastric cancer, and each one has its own benefits and risks. The choice of treatment depends on many factors, such as the stage and location of the cancer, the patient's overall health and preferences, and the availability and cost of the treatment. In this section, we will discuss the most common treatments for gastric cancer, such as surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, and palliative care. We will also provide some examples of drugs and procedures used for each treatment. The treatment of gastric cancer usually involves one or more of the following methods. Surgery is the main treatment for early-stage gastric cancer, and sometimes for advanced-stage gastric cancer as well. Surgery aims to remove the tumor and any nearby tissues that may be affected by the cancer, such as the spleen, pancreas, or lymph nodes. Surgery may also be used to create a new connection between the stomach and the intestine, or to place a stent to keep the stomach or the esophagus open. Surgery can be done in different ways, such as open surgery, laparoscopic surgery, or robotic surgery. The type of surgery depends on the size and location of the tumor, and the surgeon's experience and preference. The benefits of surgery are that it can cure or control the cancer and relieve some symptoms, such as bleeding, pain, or obstruction. The risks of surgery are that it can cause complications such as infection, bleeding, leakage, or damage to nearby organs. Surgery can also affect the patient's ability to eat and digest food and may require a special diet or nutritional supplements. Chemotherapy is the use of drugs to kill or stop the growth of cancer cells. Chemotherapy can be given before or after surgery, or as the main treatment for advanced-stage gastric cancer. Chemotherapy can be given in different ways, such as intravenous, oral, or intraperitoneal. The type of chemotherapy depends on the stage and location of the cancer and the patient's overall health and preferences. The benefits of chemotherapy are that it can shrink the tumor, prevent or delay the spread of the cancer, and improve the survival and quality of life of the patient. The risks of chemotherapy are that it can cause side effects such as nausea, vomiting, hair loss, fatigue, infection, or nerve damage. Chemotherapy can also affect the patient's blood cells and may require blood tests or transfusions. Radiation therapy is the use of high-energy rays or particles to damage or destroy cancer cells. Radiation therapy can be given before or after surgery or as the main treatment for advanced-stage gastric cancer. Radiation therapy can be given in different ways, such as external beam radiation therapy (EBRT), brachytherapy, or radioembolization. The type of radiation therapy depends on the stage and location of the cancer and the patient's overall health and preferences. The benefits of radiation therapy are that it can kill or stop the growth of cancer cells, reduce the size of the tumor, relieve some symptoms, such as pain or bleeding, and improve the survival and quality of life of the patient. The risks of radiation therapy are that it can cause side effects, such as skin irritation, nausea, vomiting, diarrhea, or ulcers. Radiation therapy can also affect the patient's normal cells and may cause long-term problems such as scarring, narrowing, or perforation of the stomach or the esophagus. Targeted therapy is the use of drugs that target specific molecules or genes that are involved in the growth and spread of cancer cells. Targeted therapy can be given alone or in combination with chemotherapy or immunotherapy as the main treatment for advanced-stage gastric cancer. Targeted therapy can be given in different ways, such as intravenous or oral. The type of targeted therapy depends on the characteristics of the cancer cells and the patient's overall health and preferences. The benefits of targeted therapy are that it can block or interfere with the signals that make the cancer cells grow and spread and improve the survival and quality of life of the patient. The risks of targeted therapy are that it can cause side effects, such as rash, diarrhea, high blood pressure, or bleeding. Targeted therapy can also affect the patient's normal cells and may cause serious problems, such as heart failure, liver damage, or allergic reactions. Immunotherapy is the use of drugs that stimulate or enhance the patient's immune system to fight the cancer cells. Immunotherapy can be given alone or in combination with chemotherapy or targeted therapy as the main treatment for advanced-stage gastric cancer. Immunotherapy can be given in different ways, such as intravenous IV or subcutaneous SC. The type of immunotherapy depends on the characteristics of the cancer cells and the patient's overall health and preferences. The benefits of immunotherapy are that it can boost or restore the patient's natural defenses against the cancer and improve the survival and quality of life of the patient. The risks of immunotherapy are that it can cause side effects such as fever, chills, fatigue, rash, or colitis. Immunotherapy can also affect the patient's normal cells and may cause serious problems such as autoimmune disorders, inflammation, or organ damage. Palliative care is the use of drugs or procedures to relieve the symptoms and improve the quality of life of the patient, without aiming to cure or control the cancer. Palliative care can be given at any stage of gastric cancer and in combination with any other treatment. Palliative care can be given in different ways, such as oral, intravenous IV, or endoscopic. The type of palliative care depends on the type and severity of the symptoms and the patient's overall health and preferences. The benefits of palliative care are that it can reduce the pain, nausea, vomiting, bleeding, or obstruction caused by the cancer and provide emotional and spiritual support to the patient and the family. The risks of palliative care are that it can cause side effects, such as constipation, drowsiness, or infection. Palliative care can also affect the patient's decision-making and communication with the healthcare team. Gastric cancer is a serious and life-threatening disease, but it is not the end of the world. There are many ways to cope with it, and many people to support you and help you. You are not alone in this fight, and you can overcome this challenge. Remember, you are strong, you are brave, and you are a survivor. Thank you for watching this video till the end. We hope that you have enjoyed it and found it valuable. If you liked this video, please give it a thumbs up, share it with your friends and family, and subscribe to our channel for more videos like this. If you have any questions, comments, or feedback, please leave them in the comment section below. We would love to hear from you and answer your queries. Until next time, take care and stay healthy. Bye.